Good afternoon, everyone. Thank you for joining for what is now our weekly COVID-19 and vaccination update. And today should be pretty brief and, more importantly, should be pretty positive because we have almost entirely good news to share, which is nice, with just one small caveat. At the very high level, our COVID rates are the lowest they've been really since last summer. So we, for the first time in quite a while, are below the 1% new positivity rate. We're at 0.94%. And then our vaccination numbers continue to tick up. We're nearing 70% of adults with receiving at least their first shot. But the one caveat is that our rate of vaccinations is slowing down, and we have to pick that up so that we can get to herd immunity and get through the last phase of this pandemic. So we'll talk about all that a little bit more, but for the quick takeaway up front, overall good news. Diving into the numbers, total case numbers are at 15,094 since the beginning of the pandemic. You can see now just shy of 380,000 tests administered to county residents, 14,709 recovered. And probably the best news of today is that we had no fatalities since my last update, and this is actually the longest period since before Thanksgiving, the longest stretch of having no fatalities in Ulster County. So that is the most important and the most positive bit of news, and it would just be absolutely phenomenal if we can continue to extend that trend, as we have lost 258 of our residents to COVID, and let's all do our part, particularly getting vaccinated, and get to that herd immunity point so that we don't lose a single additional resident to the virus. Hospitalization numbers are also looking good. These continue to decline. We're now at 7 hospitalized in Ulster County beds, 4 of them on ventilators, so we do still have a number of people seriously sick, and sick to the point that they need to be in the ICU, as a reminder of the effects of the virus and the importance of being vaccinated. Active case numbers are also looking very, very good. We are at 127 currently, 127 active COVID cases, really returning to the low levels that we saw last summer. You can see it clearly on that graph, where right around this time, or a little bit later actually, after the first wave, we stayed through the summer and really up to the fall and up to really Halloween and Thanksgiving, we stayed right around that 1% or under that 1%. So it's very good news that we're at that point again. But what I want to stress is that this is a cyclical thing, and if we don't reach a point of real herd immunity in Ulster County, which there's still thousands and thousands of people more that need to be vaccinated, if we don't reach that point, there absolutely are risks that things could get bad again. So we should not take this momentum and positive news as a sign that we can just completely give up the different things we need to do. Particularly, to me, it should be an impetus that we should more rapidly finish our vaccination work that still lies ahead. Here's a little bit more detail on the graph of our positivity rates and the number of new cases each day. You can see we are continuing to do a large number of tests. In the last 48 hours, we tested 2,115 residents, so that's still about the same numbers of testing we've been doing, 1,000 plus a day, and only had 20 new cases over that 48-hour period. So that puts us at a 0.94% new positivity rate. The 7-day rolling average is actually even lower. It's right around 0.8% on a 7-day rolling average. So the last week or so has been very good, and our collective goal has to be to keep that number below 1%, and ideally, of course, get it down to 0. Hospital capacity, no worries here. You can see the current numbers, and you can see that we have more than sufficient capacity for needs projecting forward. Shifting gears a little bit to our vaccination progress, The numbers here are encouraging. You can see that we're now well past the threshold of 100,000 Ulster County residents that have received at least their first dose. We crossed that threshold over the weekend, actually, so that was a nice milestone to hit. And as I said earlier, 67.7% of adults 18 and up have now received at least their first dose. So that is the glass half full, and I am optimistic and positive that we're continuing to make progress. But the reality is that leaves still tens of thousands of residents who are eligible who still have not been vaccinated. And I want to be very clear that I believe it is each of our civic duties and responsibility to be vaccinated, unless there's a really compelling medical reason not to, which is a very small number of folks. So please, I'm pretty sure everybody watching probably has done that part by virtue of the fact that you're tuned in and engaged here. But please spread the word. Please encourage those that are either logistically not able to or maybe even hesitant to continue to ask questions, get answers to those questions, because the science and all the research is, I think, very clear and compelling that not only are vaccines extremely effective, which we're seeing in all of our numbers, but that the risks are very, very low and absolutely essential to get to that herd immunity number, herd immunity percentage for the wider collective public good, so that we can all fully get back to normal, get our businesses fully open, get our schools fully open, our camps and childcare and all those other things, so that we can all do that safely and really breathe that sigh of relief, that deep sigh of relief that we've all been waiting for over a year. So if you have not been vaccinated yet, or you want to share with your friends, there are a tremendous number of opportunities. We're continuing to make a full court press to make it as easy as possible to remove any barriers or really obstacles or excuses for folks to be vaccinated. I'm going to put up 8 different upcoming walk-in clinics that we're doing. No appointment required, although you can make appointments if you want on vaccinateulster.com. But you can walk into any of these sites at these hours, all designed to be convenient across the wide geographic area of Ulster County. I won't read through each of these and take everybody's time, but please screenshot this and share it. We'll be sharing it on our social media, and please encourage friends and relatives, and if you want strangers on the street, please encourage them to get vaccinated. It's easy, it is free, it is safe, and it is essential. The other thing that we're doing, which is new, is we will now hold every single week, every single Thursday until we're through this, we'll hold a standing walk-in clinic at our main vaccination site at the Hudson Valley Mall at the former Best Buy location. So every single Thursday from 3 to 8 p.m., anyone can come. You can choose which of the different vaccines you'd like between Moderna, Pfizer, and Johnson & Johnson. And we intentionally designed these hours knowing that often, the normal work hours are difficult for many folks with their schedules. So our hope here is that folks could come either after work if they're working sort of typical hours, or before work if they're working later hours. But again, every single Thursday, we will have this up and running from 3 to 8 p.m. And that's another walk-in opportunity for anybody. We're continuing to offer free rides on UCAT. We'll offer door-to-door service for seniors and those with disabilities. So if you need that, you can reach out to us at the Recovery Service Center or reach out to UCAT directly. The other thing we're doing, which I'm very personally excited about, although I've already been vaccinated, but we're doing a really cool partnership with Stewarts shops, and I want to thank their leadership again. We thanked them last week. But starting next week, we'll be doing our first of 3 Stewarts walk-in vaccine clinics. Those will be in Milton, Ellenville, and Rosendale, as you can see on the screen. The first 100 people at each of those clinics will get a coupon for either ice cream of your choice or coffee. So that's pretty cool, and we really appreciate Stewarts partnering with us on this. As everybody, I think, knows, Stewarts is just such a great community partner and doing all kinds of good things, and this is an extension of that work. So we really appreciate that, and if this goes well, would love to do more to help get more people vaccinated. As always, any questions about vaccination, if you want to get more details on our different clinics, if you have questions from a health perspective, a public health perspective, there's a single point of information on our website, vaccinateulster.com. You can share that out as well with folks that may have questions. And really anything you need related to COVID, related to vaccinations, is all right there. My request of each of you today before we close is just even if you can think of one or two people in your life that you know, if they have not been vaccinated, try to reach out to them and just give them that little nudge. I happen to think that the most likely thing to change someone's mind is hearing from someone they know and that they care about that being vaccinated is important to everybody, that it's important to our community, that it really is each of our kind of responsibility to not just think about ourselves and our immediate family and our loved ones, but the broader community impacts. If we all do that, we can get to a point where we won't have any more COVID fatalities, where we'll get down to zero on new positives, and we can get everything open and going again. And I'm confident we can do that. I've seen our community rise to the challenge so many times this last 15 months or so. So this is that final, ultimate piece that we all have to do. And I thank everybody in advance for doing that. Also want to thank, as always, all of our frontline workers continuing to do their part to get us through the pandemic. I know with the new mask guidance that does present increased risk in many people's minds who have to work, who have to show up at their jobs in all of our frontline categories, from our law enforcement and first responders, delivery workers, our healthcare workers, of course, our grocery store, public transit, and teachers, and everyone else. So again, if not for yourself in terms of getting vaccinated, think about those that have had to show up to work through the pandemic, have to continue to show up. Please get vaccinated for them as well, because this will protect everybody and keep everybody healthy and safe. With that is our update for today. As I said, we'll be relatively quick and straightforward. If you need anything at all, you can always call our Recovery Service Center. We still have our great team standing by there at 845-443-8888. I want to thank Radio Kingston for continuing now 101 of these briefings to help bring this to you all. I want to thank Diane and Manuel, and each of you for tuning in, whether it's the first time you're watching. If anybody's watching right now and you think you've watched all of them, which would be pretty amazing, drop a comment in the Facebook if you've watched all of these or close to it. And I would love to shout out the people that did that, because that's pretty cool. We'll take a look at that, and next time, if people are comfortable with that, we'll give some shout outs to people that have been engaged. But the folks that have been tuned in here, you really have been really critical to get this message out across our community. So thank you for doing your part as well, and sort of serving as part of our community response to this pandemic. Our next update will be Thursday at 3 p.m. In the meantime, enjoy the beautiful spring / feels like summer weather. Be safe and healthy and stay resilient, and we will see you next week.